Consider the following. Brandon, an 8-year-old Caucasian boy who for months had been having severe abdominal pain, loss of appetite, rapid weight loss, high fevers, and had been complaining about sores in his mouth. After multiple emergency room visits, upper and lower GIs detected inflammation in the intestines, both small and large. After continuous testing and blood draws, it was later confirmed that Brandon had presented symptoms of severe Crohn's disease. Crohn's disease is a chronic inflammatory bowel disease that is characterized by inflammation in the digestive or gastrointestinal tract.
Crohn's disease can affect the entire GI tract, anywhere from the mouth to the rectum, but inflammation along with lesions are usually found in the ileum where it joins at the beginning of the colon. Within the human body, there are monocytes that release cytokines, called tumor necrosis factor alpha, known as TNFa, in response to normal inflammatory and immune responses. TNF is a protein that allows communication between cells. Communication occurs when TNF binds to cell receptors with high specificity. TNFR1 and TNFR2 are receptors known to mediate their effect on cells through signaling pathways after binding with their ligand, TNF. When working correctly, after the binding of TNF-alpha and its receptors, a reaction occurs, triggering an immune response. For the sufferers of Crohn's disease, their monocytes produce an overabundant amount of TNF-alpha, leading to inflammation within their GI tract. Humira was prescribed to Brandon after other TNF-inhibiting drugs failed. Adalimumab, the active protein in Humira, works by binding to tumor necrosis factor alpha, rendering it inactive since TNF is responsible for axis inflammatory reactions in Brandon's body. Humira, a recombinant human immunoglobulin monoclonal antibody, consists of 1,330 amino acids. It specifically binds to TNF-alpha after the Humira is injected, which is typically administered in the upper thigh. The hydrogen bonding of adalimumab with TNF-alpha blocks its interaction with TNF receptors 1 and TNF receptor 2. The blocking of the interaction between TNF-alpha and its receptors is what causes the swelling to go down in Brandon's body, and also what helps lessen the number of flare-ups Brandon has. It has been 10 years since Brandon's diagnosis of pediatric Crohn's disease. He is now a 6'1", 18-year-old senior in high school. Brandon has used Humira for 2 years and within that time frame has only had 3 flare-ups. He administers the medication by injecting every other Thursday at the same time on the hour. Thanks to Humira, along with a strict diet, Brandon lives a normal, active lifestyle as he plays varsity hockey and varsity golf. Although if he misses his shot as little as by an hour, he experiences extreme fatigue, high fevers, severe headaches, and vomiting.